Well, we're counting down to the vaccination program as India gears up for the world's biggest vaccination drive on the 16th. The Serum Institute of India and Bharat Biotech, who are producing the two vaccines which have been approved in the country, are busy sending consignments across to various cities. The vials of the vaccines are expected to be in place by the 14th ahead of the rollout. The government is planning to vaccinate over 30 crore people over the next couple of months. 3 crore healthcare workers and frontline workers will be vaccinated in the first phase of the vaccination, and it will be free of cost. Well, to talk more about the vaccination and all the frequently asked questions that many of our viewers have, we're now joined by Professor K. Srinath Reddy, President of the Public Health Foundation of India. Thank you so much, sir, for joining us on the show today. First and foremost, we've seen the example of the vaccination programs in the US and the UK and how slow they've been, much lower than expected. And so what are the challenges that you expect in India's vaccination process?
Well, the progress has been very slow in Europe as well. But I think there has been a fair amount of planning done and a good deal of coordination worked out with the various state governments, and some rehearsals have been done as well. But it's only when the rollout starts that we'll actually start seeing how well all the preparations are working. But since in the initial stages, it is the health workers and the other essential workers who are to be immunized, I think they have already been identified, and the places where they're going to be immunized have also been clearly located. And I think, therefore, in the initial stages, we are not likely to see too many glitches. It is only when it opens up to the general public, then we'll have to see how well organized we are. But I believe, given our experience in the past in organizing vaccination programs, even if it is in the universal immunization program, which is somewhat restricted to children and women, I believe we still have a greater level of efficiency than some of the other countries who have attempted this.
All right, sir. And yes, of course, we've done those nationwide dry runs for the vaccination. So speaking of the general public, when would the vaccine, do you think, be available for the general public?
Well, the Honorable Health Minister, as well as the officials of the Health Ministry, have stated that once the two groups who are defined on the basis of essential functions they perform, as well as the vulnerable health conditions which enhance their risk, are protected through prioritized immunization, then the other age groups would be looked at and the general public also would have access. So I believe it would take a few months for that to happen. Whether it will happen before September or after September is difficult to say. It depends on the pace of the vaccination, the amount of volume of vaccine available, the health workforce that is available to administer the injections. But it is likely that the other groups of the general public who are not covered by these two criteria possibly will have to wait for a few months.
Right, sir. And is an antibodies test required before getting vaccinated? If people who've had coronavirus, what about them? Do they need to get vaccinated?
It is not really required for the simple reason that the antibodies do tend to disappear in some time, though the cellular immunity may persist for a longer time. But given the fact that the natural infection has a very variable level of exposure to the virus count and the stimulus it provides to the body's immunity would also very much vary across people. We have asymptomatic people or very mildly symptomatic people who recover very quickly. In them, the viral load as well as the immune response would not have been high enough or strong enough. And therefore, it's likely that they may not have long duration immunity, which will protect them against the virus coming through again. So for that reason, a standardized vaccine with a standardized dose, and that too, a two-dose vaccine, the initial exposure followed by a booster dose, is likely to give a stronger immune response and a more durable immune response. Therefore, it is better that everybody who has had viral exposure in the past too gets it. And in any case, if you have to do antibody testing to everybody before determining whether they are candidates or not, it's going to be not only expensive, but hugely time consuming, and we lose valuable time in doing those tests first across the population and then going for immunization. And I don't think any country, whether the United States or Britain or Europe, is actually undertaking this procedure, despite the huge number of cases they've had.
Right. Sir, and what is the role of the private sector in this vaccination process?
Well, the private sector has to play a supportive role in the immunization program, which requires a very large number of adults to be provided the vaccine. They have to actually support the governmental efforts, but they have to follow the prioritized processes that the government has defined. They cannot allow people to jump the queue. The private sector is already participating in lab testing as well as in the production of the vaccine, but in the administration of the vaccine, they have to provide the kind of support that the government requires for initially addressing the prioritized groups, and then later on, when it opens up to the general public, then different modalities can be discussed. But ultimately, the private sector's role is to follow whatever are the priorities set by the government.
Right. And sir, so then in the months to come, are people actually going to get a choice in the vaccines? Right now, we have only 2 vaccines that are available. There may be more vaccines coming into the market. Will we reach a stage when people can actually go to their doctor and choose which vaccine they want to have?
Well, choice is entirely possible even now. If somebody doesn't want to take the vaccine that's being offered, that person can say, no, I'll wait for the other vaccine. But that will result in a certain amount of delay. There is no coercive measure to say that they have to take this vaccine only. But certainly the choice will widen over a period of time, because it's expected that at least 3 or 4 other candidate vaccines may also qualify by that time after having completed their trials. So by the time it opens up to the general public, it's likely that we'll have more than 2 vaccines to choose from. And then there's a greater opportunity to say, based on whatever the preferences are, that vaccine B is preferable to A or D is preferable to C.
Right. And again, coming back to the private sector playing a role, so, you know, the certain vaccines like the Pfizer or Moderna are very expensive. So will that be something that will perhaps be available in our cities and through private means to people who are willing to pay?
First of all, Moderna, the production volume has been low, and they've not even approached India for any regulatory approval. And in any case, having the US government having given it a fair amount of financing is having the first rights on the Moderna supply. So it's unlikely that Moderna will really enter the Indian market. Pfizer may enter, but it will be a niche market, confined mostly to the larger cities and maybe for the private sector utilization. But even that awaits our regulator's approval. And unless they submit all the data to the regulator, and that is clear, it cannot even start selling it in the Indian market. But there is some possibility that their interest in approaching some of the niche sections of the Indian market may come through after the regulatory review.
All right. And sir, even after we get vaccinated, doctors are saying that we need to continue following COVID appropriate behavior.
Yes, it is absolutely necessary, because it's very essential for people to understand that the vaccine protects against disease, not against infection per se. Once the virus enters the body, particularly our respiratory tract through the nose or mouth, it can stay for a few days, but the vaccines create the immunity that fights off the virus and doesn't allow it to become a disease which affects the various organs. But during this period, it is possible that the infected person, even if he is or she is protected by the vaccine, may still transmit the virus to others, though the risk is not high, because if you're not coughing or sneezing, the number of virus particles you'll discharge is likely to be low. But still, since the risk of transmissibility remains, and the current trials have not shown any evidence that the transmissibility is substantially lowered or eliminated, because that's not what they evaluated. We still have to take care that we are not infectious to others, and therefore keep the precautions on. And let us say, suppose a very severe mutant form comes in, against which this immunity is still not adequate, you still need to be protected. And in any case, there are other benefits. You're protected against influenza, you're protected against tuberculosis. So it is absolutely essential both to prevent people becoming transmitters of the virus, even if they're immune, or getting affected by other forms of the virus or other diseases, that we continue the precautions for at least for some months to come.
All right, very important for people to note that we have to continue with that COVID-appropriate behavior. So another question we get asked very frequently by our viewers is, when will children that's under 14 be vaccinated?
Well, basically, the trials have not really reached below the age of 18 years. In some cases, they have actually extended the indications up to 16 years. Now, trials are going on with the age groups from 12 years and above, but we'll have to wait and see what the efficacy is. But it appears that children, by and large, are relatively affected very minimally by the virus in terms of disease. Therefore, they're fairly well protected even if they're exposed to the virus. But at the moment, they do not form a priority group. However, there are some vaccines which may actually become available, which are mucosal vaccines, which are sterilizing vaccines which can be inhaled. And for children, instead of giving multiple injections, maybe an inhaled vaccine may become much more suitable. But those are still in relatively early stages of evaluation. We'll have to wait and see. But till that time, I believe that the children will not get vaccinated, and they'll have to depend upon other methods of protection.
And so how long will the effect of the vaccine last?
Well, we do not know yet. Basically, all our surmise is based upon what the natural infection has shown, that antibodies can last between 3 to 6 months and possibly cellular immunity lasts longer. It is surmised that immunity conferred by the vaccine will last a minimum of 1 year and possibly even up to 2 years. But right now, we have no way of knowing it for sure, because we have to follow the vaccinated people and follow their immune status over a period of time. But even if it lasts for a year and we have an opportunity to really limit the overall transmission of the virus through other public health measures in the world, then we would have actually interrupted this pandemic, and the vaccine-derived immunity would have played a substantial role in that.
Right, sir. And finally, is below 80% efficacy of the vaccine enough?
Well, actually, when the trials were initially envisaged by the regulators as well as by WHO, the specified efficacy was 50%, and with a lower limit in the confidence interval of 30%. So a 50% and above was considered to be very good. Now we are seeing efficacy rates of 80% to 90%, or even 95%. So I think this has been a bonus in that sense. But I believe anything above 50 to 60% is good enough for protecting a large number of vulnerable people and people in essential services. By the time we come to the general population, it's possible that we'll have a better idea of how severe the pandemic is still there, or whether it's a receding pandemic, and what is the urgency for vaccinating other people. But nevertheless, by all preset rules, anything above 50% is fine, 80% is very good, 90% is a big bonus.
All right. Thank you so much, Professor Reddy, for speaking to us.
Thank you.
Now, news from the UK, where it's a race to vaccinate people as the more infectious variant of coronavirus is spreading rapidly there. There are fears that health services could be overwhelmed. The government is also considering an even stricter lockdown measure. British authorities have had to set up temporary morgues in some areas outside after the local hospitals, mortuaries have run out of space due to a surge in the deaths caused by the pandemic. Britain has reported record levels of deaths and new infections in the last few weeks, fueled by the new variant of coronavirus, which has caused a surge, especially in London and southeast England. Well, to talk more about this, we're joined by Professor Geoffrey L. Smith, Head Department of Pathology, University of Cambridge. Thank you so much for speaking to us, Professor. So in the UK, really, here in India, as we're waiting for the vaccination program to begin there in the UK, it's a race against the spread of the disease.
Yes, it is. And well, first, thanks to NDTV again for the kind invitation. I'm happy to be part of your program.
Thank you.
And you're right. Your introduction puts it correctly, that it is very tough at the moment. We have large numbers of new infections still, and we have large numbers of deaths. But I think we're at about the worst that it's going to be, and things are going to get better. The vaccines are being rolled out, and estimates are up to a couple of 100,000 people per day will be immunized. And so over a period of time, we are going to build up protection in larger proportions of our population, and this will help to suppress the pandemic. But I agree with a lot of what your previous speaker had said. Very good advice that if you are offered the vaccine, then obviously one should take it. And I wouldn't worry too much about which vaccine it is. Or at least in the UK, there are now 3 that are licensed. They all have greater than 90% efficacy. And so if you get offered one, the advice would be to take it. Don't delay waiting for another one, because during the period of that delay, of course, you are still vulnerable and could contract the disease. And also, it's very important to continue to have public health control measures for everybody, including those who may have had the infection previously naturally or who have been vaccinated. As you heard a moment or two ago, it is still possible that people who have been infected or who have been vaccinated might acquire a low level of viral infection. They will not get disease, but they might have enough virus to possibly spread it. And so we need to maintain this social distancing of hand washing, face masks and keeping 2 meters apart until this pandemic is really controlled.
Right. Now, this talk of, this new variant in the UK, which has really, crippled the situation there in terms of you've got a lockdown in place, health services are being overwhelmed. But now you have the South Africa variant, and the latest is this other variant from Brazil. How worried should we be about this? Because these are variants that have been detected. We don't know if perhaps there are many more variants around.
Well, there are many, many variants. I mean, as an example of that, when the virus first was imported into the United Kingdom in February and March last year, sequencing of the genomes of those first cases showed that there were more than 1,350 genetically distinct virus strains of SARS coronavirus 2 that were imported mostly from other European countries. So the idea that we just have one strain and we've got 1 or 2 or 3 new variants is the wrong message. There is genetic diversity amongst the pool of SARS coronavirus 2. And of course, most of those variants really have no change in their biology and therefore are not likely to spread more easily, are not likely to cause more disease, and are not likely to escape existing immunity or vaccination.
Right.
But, yeah, go ahead.
Yes, Professor Smith, also have you been seeing, the numbers here in India have been going steadily down. We've been recording below 20,000 cases every day, even as we've seen the cases exploding in the US and UK. What is your assessment of this? Well,
it's a reflection of how well the nation of India and the citizens of India are doing to control the epidemic by good public health measures of hand washing, face masks and social distancing. And I warmly congratulate you all on that and encourage you to continue to do the things that you're doing so well at the moment. And if you do that, you'll keep this under control until the vaccines have been rolled out sufficiently to control the epidemic in that way. And we should follow your example and do more rigorous social distancing in UK.
All right, that is something we've seen a lot of resistance to. There's also a bit of anger against the lockdown and now talk of an even more severe lockdown being put in place. But thank you so much, Professor Smith, for speaking to us here at NDTV.
Thank you.